Good morning, everyone. My name is Michael Webb with the Youth and Schools team here at Pima County Health Department. Excited to share with you our PCHD school health update for March 16th. Thank you so much for being here and continuing to partner with us to ensure that our youth communities and school communities are safe and healthy. We have a jam-packed program today with two guest presenters. And so we're going to go ahead and jump in. As usual, if you have any questions, feel free to put them in the chat. We'll be monitoring and we will parking lot those until the end. And we'll make sure all of those questions get answered. Thank you again so much for being here, and we'll jump in now. Just an overview of our agenda today. So we'll start with some brief announcements. We're very excited to share with you a new initiative called Not Alone. We'll share some COVID-19 updates as well as an update on norovirus. And then we have a very important presentation today on your role in helping Pima County residents retain health coverage. And then as usual, we will finalize with a Q&A. Beginning with some announcements. Narcan is available for all schools, so opioid-related overdose prevention. So if you're interested in receiving Narcan at your school or associated training on fentanyl or other opioid-related substances, you can reach out to school support at pima.gov and we'll be happy to get you connected. We also have COVID test kits available. Just keep in mind some of these expired in February 2023. Now, there are some guidances that I will be sharing in the follow-up email as to some extensions depending on the brand of the test. So be on the lookout for that email that will come out following this meeting. So some of those expiration dates may be inaccurate as marked on the box. And that's always a good thing when we can get an extension on those. So just be on the lookout for that information. And of course, there's a link there for you to request COVID test kits for your site. And then we also encourage you to schedule an on-site COVID-19 vaccination clinic at your school for staff and students this spring. And you can do so by contacting our Vaccine Equity program and their email there, Vaccine Equity Scheduling at pima.gov. If you email that, one of the program coordinators will get in contact with you within the same day. We continue to offer emotional wellness presentations for staff and students. We work with a number of local community-based organizations who are experts in behavioral health facilitation. Some of these topics include practicing mindfulness, managing stress, trauma-informed care, PACT tools, and Text Talk Act. If you're newer to these calls, you may not have seen the QR code or my dorky presentation of them, but if you're not aware, you can take out your smartphone and open up your camera app and point it at that symbol there, the QR code, and that will prompt you with a link, and that's how you can access the form to view the descriptions of those presentations and sign up. There are presentations specific to staff, specific to youth, and so we hope that you can find something useful for your sites and school communities. And now I'll go ahead and jump into sharing a pretty big initiative through Pima County Health Department and the Youth and Schools program. So in responding to the COVID-19 pandemic, we know that mental health was already an important issue in our community and facing K through 12 youth and staff. And we know that COVID-19 exacerbated these challenges. And so Pima County Health Department is responding by partnering with COPE Community Services to link youth and staff who have been COVID positive since May of 2021 to free counseling services through COPE Community Services. And so this is going to be a pretty big initiative. We have designed toolkits for your sites that are complete with physical and digital assets. We'll be distributing out to the 20 largest schools in Pima County toolkits that are already ready to go. But if you are interested in receiving some flyers and things of that nature, and you'd be willing to champion this for us at your school site, please feel free when you get this presentation to click here, or you can email us at notalone@pima.gov. So we know that 1 in 3 teens are struggling with mental health right now. I mentioned that free counseling services are available through July 2023. And then we're also excited to share that for young people who are wanting to be leaders in supporting their peer communities, there's a peer-to-peer training available through the Born This Way Foundation in their Be There certificate program. So we're partnering with them as well as part of this initiative. And you can access this again with your smartphone by scanning this You Are Not Alone QR code. Or if you're old fashioned like me, you can go to pimahelpline.org/notalone. All right, and at this time, I'd like to invite Ileana from our EPI team to give us a COVID-19 update as well as norovirus. Welcome, Ileana.
Thank you. Good morning, everyone. I'll let you move on slides if you can when I'm ready to move on to the next slide, if that's okay. My name is Eliana. I'm an epidemiologist here at Pima County Health Department, and we just wanted to share with you a quick COVID-19 and norovirus update. As far as COVID-19 update, our community level remains to be low. We continue to have, unfortunately, a high transmission rate, as you can see in the second row on this slide. This is, however, a decrease from cases last week for our case rate for the county. Next slide, please. As you can see, most of the U.S. is currently on a low community level, which is represented by the green on this slide. Lots of green, which is great. Next slide, please. However, as I was mentioning, and if you have any questions about how community level is calculated, the metrics are here on this slide. For us in particular, we have a case rate of almost 65 cases per 100,000 of the population. Next slide, please. And for community transmission, which does not apply necessarily to schools, is more metric targeted for healthcare associated facilities. But we do see quite a bit of red, and we are currently in the red at this time. Next slide, please. That was it for a quick COVID-19 update. And as far as norovirus goes, I believe y'all were briefed last week as well, but a reminder never hurts based on what we're currently observing in the community. Direct contact is the main driver of norovirus cases and outbreaks. That's person-to-person contact, as you can see. And the left side of our screen here, you can get norovirus from people or surfaces. It does take a very small amount to transmit norovirus, and the key is going to be hand hygiene. Next slide, please. As we can see on this slide, on the top right corner here, our cases do tend to peak in the months of April and May. However, we are already seeing higher activity than normal for this year. Common sites to see norovirus transmission that's a little bit increased is going to be long-term care facilities, schools, cruises, based on the fact that they just tend to congregate a large number of people. And as I mentioned before, hand hygiene is key. Next slide, please. Incubation for norovirus incubation period is very quick, and that's the time between when you are exposed to the virus to when you develop symptoms. And common symptoms include stomach pain, diarrhea, vomit, fatigue, fever. This little summary slide over on the right, and that summarizes it very well. I'm sure you're all aware of what this might look like. Next slide, please. As far as the important steps of what if you observe this in one of your schools, the important thing is to report if you see anything out of the normal as far as an increase in numbers of this gastroenteritis illness in our schools. Good steps to take are to gather some sort of case log or a line list that organizes what kiddos or staff are presenting the symptoms. We might ask for what number of the total number of schools in that particular classroom. We will follow up with steps for stool and sample collection. And steps to take pretty quickly are going to include those last four. Please exclude any ill kiddos or staff, especially if they're in food handling, for 48 to 2 hours as it's written in the slide. Increase surface cleaning of high touch areas, as well as increase the amount of hand washing time, and wear PPE and disposable mops if there's any fecal accidents or vomit accidents that need to be cleaned up. Next slide, please. And as far as the outbreak response, if there is an increase in vomit, diarrhea, illness in school, that is a reportable condition. So please make sure to notify the Pima County Health Department within 24 hours if an outbreak is suspected, especially in our school settings. Like I mentioned already, please try to keep a log sheet of cases. And we will follow up with very nice kits that we have to be able to support schools kind of responding to this potential outbreaks. Next slide, please. If this does occur, please contact the Pima County Health Department Epidemiology Division. Our contact information is here. Here is our email. Our phone number is 520-724-7797. You may get a voicemail during regular hours, but we do have somebody that will provide a warm handoff to somebody else in our team to be able to assist as needed. I think this is the last slide for me, unless there's any questions, but we'll move on to Michael. Please take it away.
Hey, thank you so much for that update. And that was very concise. And that's going to move us right into our presentation with Kim. Kim, are you on the line?
I am. Hello.
Hi, Kim. If you want to go ahead and introduce yourself, you're the major presentation today. Very important topic, and I'm excited to have you on as an expert and to share how folks are going to be able to help with this important issue. Take it away.
Thanks so much, Michael, and thank you everyone for letting me join you today. This important topic is really about helping Pima County residents retain access to health care. I'm one of the deputy directors here at the health department, and I'm really overseeing Pima County Health Department and Pima County's efforts to get the word out about this important topic. So happy to join you today. Next slide. So I'll begin with talking about why we think this is such an important topic. And again, we're looking for all of you to help play a role in getting the word out related to this topic. So what we know is having people have access to health coverage matters, and it matters for lots of different reasons. The first is that it really is linked to improved health outcomes for people who are most at risk in having essentially some adverse impact in terms of health outcomes. So what we know is that Medicaid in particular, which is the public health coverage program that covers low-income individuals, including children, is linked through the research to lots of positive outcomes. It's linked to better overall health and reduced mortality, improved oral health, fewer chronic conditions, fewer hospitalizations, and even fewer emergency room visits. So it may be seen somewhat obvious that health coverage matters for health outcomes, but did you also know that it has an impact on other types of outcomes, including educational attainment? So next slide, please. So what we know through the research is that when young people have access to health coverage, they are more likely to graduate from high school. They're more likely to graduate on time. They're more likely to go on to a four-year college education and even enroll in college in general. And so, so health coverage for low-income individuals matters. And because of that, we really think it's essential for all of us to play a role in making sure people have access to and retain that health coverage. Next slide. So I'm going to talk about a few different types of public health coverage programs today and explain why essentially we want you to play some role in helping people retain access to these health coverage programs. But I want to start with sort of a primer about what is the types of public health coverage out there, make sure that everybody understands the terminology I'm going to be using. So the first is we talk about Medicaid, and Medicaid is a state federal health coverage program for low-income individuals, that includes children, under 100% of the federal poverty level. In Arizona, it's called Access, which is short for the Arizona Healthcare Cost Containment System. So you'll typically hear people use the term access. It's AHCCCS. And then again, that's Arizona's version of Medicaid. The second coverage program that I'm going to be talking about is Kids Care. Kids Care is, again, the name given to what's called the Children's Health Insurance Program, or CHIP, which again is a federal state public health coverage program. It's a program specifically available to children whose families earn between 100 and 200% of the federal poverty level. So we'll also be talking about Kids Care today. The third program you're going to be hearing about, the third type of public health coverage, is marketplace coverage. And marketplace coverage has other names. It's also called Obamacare. It's called the exchange. And essentially what it is types of private health insurance that are sold on a virtual marketplace where some sort of public subsidy is provided, making it much more affordable for individuals to be able to get that health coverage. So we'll be talking about that a bit today. The fourth type of public health coverage that you often hear described is Medicare or Medicare Advantage. We will not be talking about that today, but I simply bring it up because oftentimes people confuse Medicaid and Medicare, totally different programs. Medicare and Medicare Advantage are programs that are typically serving people the age 65 and older. So those programs are not at all affected by some of the things that I'm going to be talking about today. Okay, next slide. So why I'm here today is essentially you may be hearing that there's something called the end of the public health emergency. So during COVID, there was a declaration of a public health emergency, and it meant changes to the public health coverage programs that I just described. Those changes will be ending or terminating at the end of the public health emergency. So what happened during the public health emergency that affected these programs? Well, one was that anybody on Access or Kids Care was able to stay on no matter what. Typically, they renew every year, but they were allowed to stay on. And they did not lose their coverage unless they requested specifically to be removed or if a member of those programs died. So everybody was able to retain their coverage. During the pandemic also, there was a termination of premiums for Kids Care. So Kids Care, this public health program, typically prior to the pandemic, required the payment of monthly premiums. They're sort of low-cost premiums, but they are nonetheless premiums. And so during the pandemic, they didn't have to pay those monthly premiums. With the ending of the public health emergency, people will once again have to start paying those monthly premiums. And then finally, during the pandemic, people did not have to respond to any paperwork that was sent by Access. So Access continued to renew people automatically if they had information suggesting that they were still eligible. And if they requested information from individuals, if individuals didn't respond, they stayed on coverage. But that will change again with the ending of the public health emergency. Next slide. So as of April 1st, regular renewals for individuals enrolled in both Kids Care and Access will begin again. And that doesn't mean that everybody will have to renew on April 1st. It means that during your regularly scheduled renewal date, you will actually have to renew coverage again. And so again, that'll be a change that will begin April 1st and happen over the next year. Next slide. So why does this matter and why are we talking about this? Well, it's estimated that about 600,000 Arizonans statewide will be impacted by this change and potentially lose coverage. About half of those people are people who will lose coverage because Access essentially can't get in touch with them. Their information may be out of date, and so they will have to be able, Access will be seeking information from people who are enrolled. And because people have moved or they don't have current email addresses, et cetera, Access may lose contact with them and people may lose coverage. So we want everybody to update their contact information to make sure that Access can connect with them. The other half of people who will potentially lose coverage are people who no longer qualify for access or kids care. So their income may have gone up during the pandemic, which is a great thing. But essentially because of that, they are no longer eligible for these two public health insurance programs. What we want to make sure they are aware of is that there are other coverage options through the marketplace or the exchange that will allow them to be able to purchase low-cost health coverage. We want to make sure that they remain covered and so that they understand how they can get assistance. We estimate that about 90,000 people in Pima County will be at risk of losing coverage, which is a significant number of people. And so because of that, we're really trying to get the word out to everyone and think about how you can play a role in helping address this issue and get the word out. And really two main messages we're trying to convey. So we're asking all of us, all of you, what is your plan to help Access Kids Care members retain coverage? And what is your plan to help unqualified Access Kids Care members find new coverage? And so again, we think everybody can play a role in this. So next slide. So this slide briefly shows where essentially people are at risk for losing coverage. Not surprisingly, the largest number of places, Tucson's listed as second, being the second largest city. But we also have communities such as Lukeville, where we have a high proportion of the population who may be at risk for losing coverage. So, you know, we want to think about not only our urban metro centers, but rural areas where people may be at risk. Next slide. And this slide shows essentially the demographics of the population most at risk. And part of the reason why we're talking to all of you today, as you can see at the bottom of the slide, 36% of those most at risk are children. And this shouldn't be shocking because we know a lot of children in Arizona live in poverty. And so a lot of kids are at risk of losing coverage. And again, this matters not only for their health outcomes, but for their educational attainment. And not surprising, again, we certainly see that a disproportionate portion of the population of people of color are likely to be affected. And so we really want to think about this through an equity lens and make sure that any of our efforts to be able to do outreach are essentially thinking about those most at risk, including people of color. Next slide. So what is the messaging that we're looking for everybody to engage in? So really, we want three messages to get out there. The first is when you connect with families or community groups who are working with families, we want you to be able to communicate and ask whether a family member has access or kids care. And if they do, we want you to encourage them to update their contact information, their mailing address, phone number, email address, by logging on to healthyarizonaplus.org to make sure they and their family members stay covered. We want to alert them to the fact that regular renewals will begin again as of April 1st. If we also want to encourage them to respond to Access if they are contacted. And if they need help in terms of responding to Access, they can get help through coveraz.org or the 800 number on the screen. And then their families making more money, we want to covered. And so they need to understand that there are options available through the marketplace. And if they need help essentially investigating those options or enrolling in that alternative coverage, they can get free enrollment assistance by calling 211 or coveraz.org/connector. Next slide. We have, as a Pima County Health Department, developed a lot of resources to help you get this word out. We have flyers, postcards, posters, social media graphics, talking points. So Michael can talk about how you can have access to all of those materials, but we're happy to help you get the word out and have developed a bunch of resources that make it really easy for you to be able to access these resources and share this messaging with families. Next slide. The flyers themselves talk about provide information on how you update your contact information that's really easy to understand. So it talks about, for example, how the Access program currently pings a lot of other information to update information for renewals, but sometimes they need essentially to reach out to you nonetheless to be able to get more up-to-date information. And because of that, they really need their contact information. And to be able to update your contact information, you'd have to go to this healthyarizonaplus.gov website to be able to update the information accordingly. Next slide. And the flyers that we're disseminating, which again, Michael can help you access, actually on the flip side of it tells you exactly where on the website to go, exactly what to click on to be able to update your information. So we make it really easy for you to be able to share this information. Next slide. And then finally, the second message that we've developed a flyer for has to do with what happens if you lose coverage. And so again, we're encouraging people to go to 211 or the coverarizona.org connector website to be able to find enrollment assistance. So if people want that marketplace coverage, they can find somebody who's been trained to be able to help you examine the options, see how you qualify for subsidies, see how you can continue to stay covered. So with that, I will pause and see if there are any questions.
Thank you so much, Kim. If anyone has questions for Kim or Ileana or any announcements, feel free to put them in the chat now. I'll go ahead and continue through closing out the meeting, and we'll see if any questions come in, if our presenters can stay on, just in case there are questions pertinent to your topic area this morning. But hey, Kim, thank you so much. This is such an important thing, and you're so passionate. And I hope that, you know, with our preparation in this, we're giving the tools to our school partners so that they can, you know, be ambassadors and help us out. And so thank you so much for putting that together. And Ileana, thank you so much for keeping us updated with the relevant EPI-related things in the world. We're a power team.
And Michael, there was a question about how we can get the flyers. So basically, if people just, and there was a question about, are they in Spanish too? They are in English and in Spanish. So that's a great question. So Michael, can you just perhaps let people know how they can access those resources?
I sure can. So I'm putting it in the chat now. If you want to email us at schoolsupport@pima.gov, we can make sure that you get access to those physical or digital assets so that you can hang them up in your school or disseminate as you see best. Great question. And just as a reminder, our next schools call will occur not next week, but on Thursday, March 30th at 9 a.m. We have moved to a bi-weekly schedule, so meeting on the first and third Thursdays, but as usual, we want to make sure that we're accessible to you any day of the week. So you can email us at schoolsupport@pima.gov or via our school support phone line at 520-724-7018. And Matt, I see in the chat that you said we'll include these resources as attachments in the follow-up email. It's a great idea. So we'll make sure that that email follow-up is pretty robust and comprehensive. So be on the lookout for that. And then just some associated resources when you get this PowerPoint slide deck in your email. These are a lot of the different things that we talked about today. And we'll make sure that you are well supported in accessing all of the valuable information we've shared here. And as usual, you can visit us at pima.gov/healthyschools. You can call that school support phone line here or email us at schoolsupport@pima.gov. And now I will open it up for questions. See if any arrive in the chat. All right. Well, I'm not seeing any other questions in the chat, but I do want to wish all of you a wonderful rest of your Thursday. Hopefully tomorrow, Friday, is easygoing and you can have a long, restful weekend. And we look forward to seeing you on the 30th. And please be on the lookout for this follow-up email with all of the valuable health promotion information we've discussed today. And with that, I'll go ahead and end the meeting. Thank you so much.
Thank you. Have a nice rest of your day.
Thank you so much.